Hello, my name is Maya Marcian, and the topic of my video essay is cervical cancer in Sub-Saharan Africa. I have titled this piece The Fight for Prevention and Care because of my argument, which you will see later in this essay. In order to understand my argument and why cervical cancer in Sub-Saharan Africa is an issue, you must first understand what cervical cancer is. Cervical cancer is when abnormal cells start to grow and appear in the cervical tissue. If these cells are not removed or destroyed, these cells become cancer cells. Through my research, I have learned that there are two types of cervical cancer. So, what is the cause? HPV, also known as oncogenic human papillomavirus, has been identified as a key cause of cervical cancer. You can catch HPV, which is a sexually transmitted disease. How is cancer identified? Cervical cancer is identified through screening. Screening for cervical cancer enables the identification of precancerous lesions at stages where they can be easily treated. Screening is done through the human papillomavirus screening and panapicolu smear screening, also known as a pap smear. These are normally done in a doctor's office or a clinic. Cervical cancer can be deadly. As you can see in the image found on the World Health Organization's website, this image also highlights the need and importance of having access to this type of care. Screening is a preventative step that can identify and start the treatment of cervical cancer before it is too late. My central argument and thesis for this essay is, despite being largely preventative, cervical cancer remains a leading cause of death among women in sub-Saharan Africa due to barriers in screening access, healthcare infrastructure, and socioeconomic disparities. Addressing these challenges requires improved preventative services, policy reforms, and community-driven interventions to positively increase early detection and treatment. Throughout my research, I saw a large number of factors that supported this idea. Multiple sources and studies that I read showcased alarming statistics that emphasize why cervical cancer is an issue in this area and why there needs to be increased access to screening. Each year, there are approximately 250,000 deaths, most of which occur in sub-Saharan Africa, South Asia, and Latin America. This quote shows how out of 250,000 people, most of them are based in sub-Saharan Africa and other areas around there. In sub-Saharan Africa, a 5-year survival rate can be as low as 35%. Going off the last quote, if cervical cancer is caught early on, the survival rates can be high. In comparison to other areas, the statistic of 35% can be low. In sub-Saharan Africa, cervical cancer is responsible for the highest number of females' deaths, with a mortality rate of 23 cases per 100,000 women, compared to 2 cases per 100,000 women in the United States of America. This quote compares the death rates in America and sub-Saharan Africa, showing how, on average, about 21 more women will die per 100,000. This may not seem like a lot, but at the rate that cervical cancer is being caught and missed, it can show a large difference. And the last statistic that I have is the distribution of cervical cancer cases globally is disproportionately lower among high-income countries than among low to middle-income countries because of the high coverage of organized screening services and adequate treatment of precancerous lesions in the former. This quote shows how higher income countries are able to easily afford and provide screening, which leads to better treatment and supervision of precancerous lesions. Sub-Saharan Africa has lower income in comparison and struggles to provide this type of support. All these statistics prompt us to ask the question, why are these numbers so high, and why do these people lack access to treatment and screening? The keyword that describes this problem is lacking. The answer is that sub-Saharan Africa lacks the financial support due to the high cost of the test. There is no good attitude and acceptance of the partner if they need testing or support with the disease, which causes a fear of the test result as a positive due to stigma. These women do not know where the place for screening is performed. They are confused about where the nearest screening center would be or how they would get there. This means that they do not fully understand the process and they wonder if the screening is painful. Most of the reasons can be attributed to the lack of knowledge about cervical cancer and screening. I think it is important to talk about why there needs to be a change in access to healthcare and screening. Women experience many psychosocial effects due to the lack of access to and the diagnosis of cervical cancer. This leads to a few questions. How do these barriers make women feel? These barriers make women feel fearful, ashamed, isolated, and anxious about seeking cervical cancer screening. How do these women feel when they are diagnosed? Women often feel devastated, hopeless, and overwhelmed when diagnosed, especially if they face delays due to barriers. How do these barriers impact women's mental health and the perception of themselves? The barriers worsen women's mental health, causing stress, depression, and feelings of worthlessness or neglect. What makes these women skip the screening? Women often skip the screening due to the fear of the procedure or results, stigma, lack of knowledge, and difficulty accessing affordable care. So, moving forward, this argument has emphasized the question of what to do now to move forward. There are always new technologies forming that can increase access to screening. One of those current methods is self sampling, which can be sent in and tested or screened. Overall, the main goal is to increase the screening. Increased screening can be done through community engagement, education, addressing stigma and social norms, as well as increasing policy and funding support. Education and prevention are essential to reducing the high rates of cervical cancer in sub-Saharan Africa. Throughout the research and readings, it shows how many women lack awareness about this disease. In conclusion, and based on my arguments and research, cervical cancer in sub-Saharan Africa is a preventable tragedy made worse by limited access to care and deep social inequalities. To save lives, there must be expanded HPV vaccination, improved screening, strengthened healthcare systems, and engagement of communities. Thank you. Any questions?